Hi, my name is Lacey. I'm going to be your nurse practitioner student today assessing you. Can you tell me your first and last name?
Russell Martin.
And can you tell me the date?
August 30th.
Great. And what city are you in right now?
Pleasant Hill, California.
Great. And who is the president?
Biden.
Okay. So we're going to start our physical assessment. What we'll do first is we've already done your vital signs. They look great. They're stable and normal. We'll do a head-to-toe physical assessment. We'll be sitting in the chair most of the time, and then we'll have you lie down over here in a little bit. Do you have any pain right now? 10 being the worst pain of your life and 0 none at all?
None at all.
Okay. So what we're going to do first is I will start to look at his head. I'm going to be literally starting from the head and ending at the toe area. And part of my assessment, I'll be inspecting, palpating, percussing, and auscultating most body systems in that order, except for the abdomen. So right now I'm just inspecting your skin visually, looking at your head. I'm seeing if there's any abnormalities that stick out for me, deformities, things like that. I'm looking at your eyebrows, making sure that they're symmetrical, and I will start to palpate your head to feel for any contusions or deformities as well, or masses, things like that. I will also be looking at your eyes, including your sclera and your conjunctiva, and then going down from there. So I'll be I'll go ahead and inspect and actually now palpate his head, and I don't feel anything abnormal. Okay. And I'm looking at his eyes. Go ahead and look at me. His sclera look white. Go ahead and do this for me so I can see. Perfect. Conjunctiva is pink, not red. You can put it back up. I'm looking at his pupils and his iris, and I will start to do a pupillometry exam as well. In addition, I'm looking at his nose. I don't see anything on his face that sticks out to me that's abnormal. So just go ahead and look kind of right over my shoulder, a little bit closer to me, straight away, right over my shoulder. Perfect. And I'm just kind of looking to see if his pupils react to my pen light, my pupillometer. Good. Perfect. And then go ahead and look at my pen light and follow it. Perfect. So his pupils are equal, round, reactive to light, and they accommodate appropriately. Next, I'm going to be doing the 6 cardinal gazes, field gazes. So go ahead and look at my pen. Great. Without moving your head. Perfect. Good. Beautiful. Next up, I'll look at his neck. I haven't seen anything abnormal so far. Actually, first I'll do the ears and nose, and then the mouth, and then I'll continue on to the neck. So for his nose, go ahead and just look up like that. Perfect. And you can just go ahead and look straight forward. Usually I'd be using an otoscope, but right now all I have is my pen light. And I don't see any cerumen or earwax. That's external. Do you have any ear pain or issues with your nose, mouth?
No.
No. Okay, go ahead and open your mouth for me. So I'm looking at his soft palate, his hard palate. I'm looking at his dentition, his teeth, his tongue. Go ahead and lift your tongue up to the roof of your mouth. Perfect. I don't see any leukoplasia or signs of oral cancer. And go ahead and lift it, put it down. And say, ah. Good. All right. So everything is symmetrical. His uvula, his soft, hard palate, everything is pink. Nothing, I don't see any like white patches or concerning parts in his mouth that I would further investigate. I also don't see any visible moles that I would do the ABCDE tests on or assessment. So I will continue down now to his neck. So what I'll do is I will hand you a cup of water at one point so you can swallow, and I can kind of test your thyroid area. Before I do that, I'm just going to quickly look at your sinuses, assess your sinuses. So I'm going to go ahead and palpate here. Do you feel any tenderness?
No.
Good. Okay. Nasolabial folds are symmetrical as well. Okay, so I'll start from behind you. I'll have you swallow a glass or a sip of water while I'm from the back kind of assessing your thyroid area and your neck. I'm also going to be assessing for any lymph node enlargement as well. Okay, so go ahead and have this ready and I'll let you know when to take that sip of water and swallow it. Okay. Go ahead and swallow. Perfect. Okay. And I'm just gonna palpate his lymph nodes. Anteriorly and then posteriorly. Let me know if you feel any tenderness. Okay, so get ready to swallow your next sip of water, and just anteriorly I'll be assessing when you swallow.
Okay.
Go ahead. Good. And I feel his little sternal notch as well right here, and that feels normal. I don't feel any thyroid abnormalities or enlargements. Next part of my assessment, I'll be looking at the his posterior thorax, so the back of his lungs. Thank you. And I'll first inspect, then palpate and percuss the backside of his lungs. And then I'll go anteriorly, again looking for any abnormalities and listening for adventitious breath sounds or any abnormal breath sounds. So just go ahead and lean forward for me. And actually, so that the video can see, I'm going to turn your chair around, if you don't mind. There we go. Okay. Okay, go ahead and take a big deep breath in. And again. And I was just assessing for diaphragmatic excursion there. And I'm going to go ahead and palpate it. I don't feel anything abnormal. Any tenderness that you have back here?
No.
Okay. Okay. So I'm going to go ahead and percuss the backside of your lungs. So you'll just kind of feel me tapping a little bit like that. Perfect. I'm going to go ahead and now listen to the backside of your lungs. So go ahead and take, every time you feel my stethoscope on your back, you'll take a nice big inhale with your mouth open in and out.
Okay.
Good. Great. Perfect. So we'll go ahead and turn the chair back around, and I'll do that same kind of sequence of events on the anterior side of your lungs. Okay. So I'm just going to palpate. Okay. And I'm going to percuss. Okay. And we'll go ahead and auscultate. Okay. Same thing, nice big deep breaths in and out. So I'll go ahead and do my cardiovascular assessment. There will be six positions of his heart that I'll be listening to. You can stay sitting just right here, and I'll be listening for any murmurs or any sounds of his heart that are clicking noises or things that should not be present. So you can just breathe normally for this.
Okay.
For the last three parts of his cardiac assessment, as far as the auscultation goes, I'll be using the bell of my stethoscope, which is more sensitive to the pulmonic tricuspid and mitral valve. Okay, and I don't hear any abnormal heart sounds or murmurs present at this time. So next, we will defer the genitourinary and rectal exam today, but normally that would, for a male, definitely involve a prostate exam. As far as a musculoskeletal assessment, I am looking at his upper and lower extremities for any edema, deformities, bruising, ecchymosis, things like that, lesions as well. And this is a good time to also, since we're going to be paying closer attention to his extremities, to see if any moles are present that I am concerned about, and then maybe possibly need a dermatology consult as well. So I'll start on his upper extremities. Again, I'm going to be looking for edema or swelling, and I'm going to palpate his radial and pedal pulses. Okay, so again, just starting with inspecting, palpating. No percussion for the musculoskeletal assessment, but I will be, like I said, palpating his radial pulses. So those are 2+ normal pulses, and I don't see any swelling. You can just relax your arms. Capillary refill is less than 3 seconds, and I don't see any clubbing of his fingertips either. So I'm going to go ahead and look at his legs now. I'm just going to go ahead and adjust the screen. Good. Okay, and then I will have you take your shoes off if you don't mind, and your socks.
Okay.
Perfect. I don't see anything on his feet as he's taking his shoes and socks off. I don't see any swelling whatsoever, but I always like to press my fingertips against my patient's skin to see if there is any pitting that is kind of hiding. Sometimes that happens in the ankles. I don't see anything at all, and now I'm going to be assessing his pedal pulses. Perfect. So those are equal, symmetrical bilaterally. Next, we'll be doing a brief shortened assessment, neuro assessment, and then we will finish with we can do our abdominal assessment first. Since you're sitting here, we'll do the cranial nerve assessment first, and then we'll go ahead and lay down and do the abdominal assessment.
Okay.
So since you're sitting up, we'll just start with this one. Typically, unless there's anything that we suspect that's abnormal with the patient's olfactory nerve, which is cranial nerve number 1, we usually don't test that, but we could close his eyes and put something under his nose that is potent, like coffee or something like that, for him to identify. Optic or cranial nerve number 2 is the optic nerve, and that is the nerve to test eyesight. So usually the Snellen eye chart is used. I did see in your record that you just went to your ophthalmologist last week, and your vision was 20/20. Is that right?
Actually, it was.
That's great. So next we'll do the cranial nerve number 3, 4, and 6. So that's the oculomotor, trochlear, and abducens cranial nerve, and that's the extraocular movements. And that's kind of what we already did earlier, which was where we did the 6 cardinal fields of gaze. So that's where he followed my pen light in 6 different directions, and he did that very well. The cranial number 5 is the trigeminal nerve, and that's where I'll ask him to do a couple of things. So can you clench your teeth? Good. Can you blow out your cheeks? Perfect. And then can you give me like a frowny grin? And then show your teeth? Perfect. Okay, good. We can also, because that's a motor and sensory nerve, we can have him close his eyes. So close your eyes. And then see if he can identify when I am touching him. So let me know if I am touching you. Just say now.
Now.
Good.
Now.
Good. And you can use a dull or sharp sensation with that as well to test it. Cranial nerve number 7 is our facial nerve. Actually, that was the one where we had you puff out your cheeks. Cranial nerve number 5 is more the clenching of the jaw, and then the sharp and dull sensations. Cranial nerve number 8 is an acoustic nerve, so that is hearing. So I'm going to go ahead and block one of your ears while I whisper a number in the other ear, and I would like you to repeat that.
$40. $21.
Good. Okay, so he identified those correctly. Cranial nerve number 9 and cranial nerve number 10. So cranial nerve number 9 is the glossopharyngeal, 10 is vagus. Throughout my entire assessment, as the patient's here, I have made note of many things, as in when he walked in from the hallway, I was noting his gait, his posture I've been noting, which is nice and upright and erect. I've also been noting his voice, which is the cranial nerve number 9 and 10, that hoarseness that we're kind of trying to find. We're not trying to find, but trying to assess, along with any nasal quality to when he speaks. His mouth is symmetrical. We did do in the head, ears, eyes, neck, and throat assessment. At the beginning of this assessment, we did look at his mouth. His soft and hard palate are nice and pink. There is no white patches, redness, exudate that is concerning. Cranial nerve number 10 is checking the gag reflex, and number 11 is spinal. When I was doing part of his posterior thorax assessment, I was checking against his spine, and there were no abnormalities or tenderness for him either. But for this, I will also have him shrug his shoulders, shrug your shoulders, and then I'm going to push against them. So let me go ahead and do that. Okay, shrug your shoulders. Perfect. And then I want you to turn towards your left, your face. Good. And your right. Perfect. So he's nice and strong. Both are equal on each side. The last one is the cranial nerve number 12, which is the hypoglossal cranial nerve. So I'll have you go ahead and stick out your tongue. Perfect. And I don't see any deviation to one side or the other. So that is a nice midline normal cranial nerve number 12 hypoglossal nerve. So lastly, we'll do the abdomen assessment. So I'll have you lay down over here. Yeah. Okay. All right. So now what I was saying earlier is that typically we use the inspection, palpation, percussion, and auscultation order. However, with the abdomen, it can, if we palpate or percuss first, what can happen is it can change the bowel sound. So first we will go ahead and inspect his abdomen, and then I will auscultate it. Just gonna lift up your shirt. So on inspection, I don't see anything concerning. I don't see any like popping out signs of enlargement of his liver or spleen. But before I palpate, like I said, I'm going to go ahead and auscultate. Perfect. So he has normal active bowel sounds. Now I'm going to palpate. I'm going to start palpating very lightly, and then I will transition to a deeper palpation. Good. Percussing over the liver and spleen. I'll do that as well, and then I should hear it be more hollow in areas over the stomach rather than solid organs such as the liver and spleen. So I can really hear the difference between his liver, solid organs, and then peritoneal area. And that concludes the head to toe assessment.
Thank you.
Thank you.